Professor Mavalankar, by combining your own training in medicine and public health with the management and having spanned the spectrum from health management to broader public health, you experience the need to be very practical in your approach to the application of research to this problem. How do you think HPSR can actually translate into benefit for UHC in India? Overall Indian context and in that context.
I thought the way I approached this question was to look at what universal health coverage needs and what HPSR can provide. And I begin with, I think, a very different kind of need to ensure universal health care, which is a high level of social and political commitment. And if you look at the countries which achieved, if you look at Germany, started about a journey of 120, 130 years ago through social legislation. UK about 60 years ago at National Health Service, etc. So my sense is, even before a lot of research was done, many countries achieved universal care because they cared for their people. The people in power cared for the people in the country. So I think the question for us as researchers is, how do we in today's India create the research which will motivate the political, the administrative, not only in health but in finance and the most powerful ministries in PMOs and CMOs, Chief Minister's Office, people who are really committed to providing care to each and every citizen. And I think it's a very different dimension of universal care, saying how do we create political commitment, because out of which will flow the resources and the things needed, conditions for achieving universal care. So that is one way. So it's a challenge for us to understand the politics of universal care or major social commitments and change. Second, of course, it is somewhat easier, and as has been said, is universal care in India's sort of hodgepodge healthcare system is an incremental journey. We have to sort of see where or what we are covering, how can we expand the coverage, how can we increase the depth, and how can we increase the protection against financial problems because of health. And all of that, our research can show where we are, how much are the gaps, and in what directions we need to move. And whether it is really movable, how much the next issue will come is our coverages are very, very different in many states and in some sense city by city. Because many cities have different coverages than in other cities given their medical investments in the health system which they created over the years. So in some sense we have to measure what is the current coverages in each city or in each district and move from there to saying how do we reach universal coverage. The third issue is universal coverage will need more money and more money allocated to the right kinds of things, and that is where the health systems and policy research will help to identify what are the priorities where money is currently used, where can we shift the money, how much more money will be needed and where should it go. And in some sense India is blessed because it's a very large country with all kinds of states and union territories and city governments with all kinds of schemes and experiments and yojanas. So study of that itself will provide us with a rich matrix of what works, what doesn't work, what wastes money and what is more effective. The fourth point is, in this journey of universal care, we have to continuously monitor our progress and evaluate the steps. Because in any sort of democratic politics, decisions are taken many times in the right direction, in the haste, and we need to continuously monitor. The health secretary also used very interesting term, putting the ear to the ground to see whether the policies taken in the state capital or Delhi and the programs and schemes and yojanas are reaching the most remote areas and the most needy. So the research will at least provide us with that kind of a lens and barometer to see how much are we succeeding. Another point is that universal health care in India will need in some sense a whole network, a network of providers, a network of funders, managers and knowledge partners. And the HPSR community can act under the consortium as a knowledge partner to this journey of moving from current coverages to higher and higher coverages. And I think one of the challenges is how to make these networks function, because in such large country and such diverse and privatized health system, we have a lot of vested interest to protect against, because we have very deep-rooted private system with certain interests, and universal coverage may means different things to different people, and how do we make progress in this kind of very diverse situation. Finally, I want to end by highlighting some barriers I see to health policy and systems research in Indian context. First of all, we are a very hierarchical society, and our traditional ways of beliefs, customs, etc. is the evidence is what the top level says, not what data shows. So my sense is, many times it was said, why are we not asking the right question? Why are researchers? I was joking to Geeta, I said those who ask the right questions are blacklisted. So obviously nobody will ask the right question. So we have to move from that. Of course there are changes and there are sort of green shoots and improvements, and more politicians and bureaucrats and ministers and secretaries are open to data and evidence and how do we move in the right direction. So the other barrier is that many times our policy makers and top administrators, rather than making policies, are wedded to projects, yojnas, actions and activities. They want to look at micro level, saying how will this ASHA be trained, how will this happen, how much money will go to this particular activity, rather than looking at very macro decisions. So I think how do we move our top people from looking at the micro level to moving and having a macro level view of situations, policies, and be really policy makers rather than micro level file signers who keep on signing various macro level orders and micro level schemes, etc. So that is another challenge, to how to really convert our policy makers to look at larger policies. With this, finally I want to say that HPSR, I think, is like a compass on our long voyage for achieving universal health care. Unless we use it properly, we might get lost into the sea of huge health system with great diversity. Thank you.